14 days in, and we were headed out.
Checking out after 2 weeks of quarantine, the whole team feeling good, continuing on.
How the three of us, CNN photojournalist Natalie Thomas, producer Yong Sheng, and I ended up here is because of where we were 2 weeks earlier, a far more stressful hotel checkout. This was our 3:30 a.m. scramble to the train station. We'd planned for a few days in Wuhan, but 29 hours in, the phone rang, the city was going on lockdown, and we needed to get out. In the moment, we really could not imagine how big this would get. Millions under lockdown restrictions, rapidly rising death tolls, tens of thousands infected, and mainland China essentially isolated from the rest of the world. And we were at the epicenter. CNN decided we should return to Beijing and immediately limit our exposure to others. But we still wanted to tell the story, and we had 350 square feet to do it.
So not a bad commute from my bedroom to the living room, or our studios essentially. Can even do it in slippers. This is the backdrop that we've got over here. Snowing today. We, in between live reports, have been doing a lot of research. Young, our producer, been on the phone a lot, working his sources in Wuhan and Hubei province in particular, in between some of our reports. Natalie, behind the camera there, doing the same.
When we weren't on air, we were consumed with getting the story right.
Sure, mic check 1, 2, 3.
But truthfully, we were still feeling a bit guilty that we walked away from the people of Wuhan. It especially weighed on Yang and Natalie. Yang being Chinese and Natalie having called this country home for nearly a decade. For them, it was personal. So we worked all hours, either video chatting or calling dozens of people still in Wuhan. Yang focusing his efforts on a doctor who tried to sound the alarm early on. Natalie learning from healthcare workers about the dire need for supplies.
The big decision.
Our meals, room service. But just to be safe, for the entire stay, we didn't let hotel staff come into our rooms. And, well, they seemed good with that. As soon as they knocked, we opened, and they bolted down the hall. Even with just a few hours of sleep each night, we were fueled by adrenaline to keep on. To be honest, Natalie and Yang motivated me. Admittedly, we did take one night to relax. It was Chinese New Year Eve, and it was really important to Yang. But then, back to work. Until our time was up, day 14.
All right, everything back to the way it was, and we now head out into snowy Beijing, but masks on this time.
Stepping out into the frigid Beijing air, hopping in the car, and continuing our pursuit of this story.
Even after nearly 2 decades, former SARS patient Alex Lam is haunted by his experience.
I was put in a big room with many other patients. I heard some coughing at night, crying, and that's really sad. It's really sad.
SARS infected around 8,000 people globally and killed 774, nearly half of them in Hong Kong. The isolation of cases eventually led to the end of the outbreak. The new coronavirus outbreak is already larger than SARS, and unprecedented measures are in place to control it. The rapid construction of hospitals, mass production of medical supplies and protective equipment, and sweeping travel restrictions and temperature checks. When will these measures stop the outbreak? Well, the answer lies in understanding the virus itself.
Inside that building is the world's first lab-grown copy of the Wuhan coronavirus outside mainland China. It's a major breakthrough that allows researchers here at Hong Kong University to better understand the behavior of the virus.
Inside the lab, we are required to wear face masks.
My feeling is that this is just going to be like SARS, is that the world is going to get basically a very bad cold for about 5 months.
But with one major caveat, it appears the new virus, unlike SARS, can spread before symptoms arrive.
But the problem with this virus is that it does appear is that there is a period within the first 4 or 5 days where people say they can be virus shedding but maybe asymptomatic. So for that reason, it's going to be far more difficult to manage.
I want to shake your hand, but it's during an outbreak, so...
The masks are off when I meet Malik Paris in his office. He advises the World Health Organization on the virus.
Either Indian way of greeting or the Japanese way of greeting.
He says there are 2 extreme scenarios. The outbreak is brought under control, or...
The other extreme, of course, is that the virus is like influenza, which means that it cannot be contained and it will spread.
This has already happened with H1N1, also known as swine flu. The strain emerged in a pandemic in 2009, and now it's a seasonal virus. But for Alex Lam, humankind doesn't need another disease to contend with.
We must stand together. We need to think positive, because one day the disease will go away.
Now the head of a group of SARS survivors in Hong Kong, he is calling for the government to take tougher measures, whatever it takes to end the latest outbreak. Christy Lustout, CNN, Hong Kong.